So, welcome everyone to the webinar. I'm Dr. Preeti Jindal, Director and Senior Consultant at the Touch Clinic Mohali, which is an advanced IVF and high-risk pregnancy and cosmetic gynae center. You all know that we have started this webinar series to help our women, pregnant women who face lots of questions in their mind, and during a consultation which is there for 20 to 30 minutes, it's not possible every time to answer every question, and also many times the women they forget also what to ask. So these are few questions which are very simple for probably for the people, but the person who is dealing with it, they find it very taxing and they want to know their answer. So in this series, we are going to cover very simple and but very important topics, and these are being held on every Friday between 4 to 5. And we are you can always look at the next topic at our website www.touchclinic.com. So today's webinar is on nausea and vomiting of pregnancy and how to deal with it. I will be taking the first part of it, and my consultant Dr. Cherry will take the second part of it. So what is morning sickness? The morning sickness is a name which was given to nausea and vomiting and a change in the taste which many women experience in their pregnancy. It was called morning because usually it used to happen in the morning, but it is a misnomer because this type of sickness, pregnancy sickness, can happen even in the evening or in the afternoon. You may feel nauseous all day long. Many times, going to be mom are not able to keep anything down. Also, the smell of certain foods make them nauseous. Just thinking about certain food can also make you nauseous. Also, you feel that you can't even remember what it is to feel normal. Also, it has been seen that the smell from someone near and dear to you, especially your husband, your elder child maybe, or the smell of the home, even this can make you feel very nauseous. First thing which you should know that you are not the only one facing it. You are not alone. Most of the women, they face this problem, and especially the first time mom, they face it a lot and they are lost thinking whether to enjoy the pregnancy or not to enjoy, whether this is normal or this is not normal. But to let you know that this is a very normal sensation, and it is because of the pregnancy hormones. It is an unpleasant, painless sensation that may end up with a vomiting or throwing up. Vomiting is actually throwing out of the contents of your stomach or in your mouth forcefully outside, and it is involuntary. If you look at the definitions, motion sickness is nausea felt by pregnant women whenever they are traveling. Morning sickness is when they get up in the morning. It is also known as emesis gravidarum. Emesis means vomiting, gravidarum means pregnancy. So most 80 to 90% of the women they feel some kind of nausea which is normal, which is known as emesis gravidarum. But when does it become abnormal? So abnormal vomiting, that is the hyperemesis gravidarum, is that vomiting which is not confined only to morning or evening, but it occurs throughout the day, and it is not leading to any and it is not subsiding with any medication. Also, you are not able to keep any food. What we normally tell women is that if you eat food and you vomit, even after 10 minutes, you don't have to worry because most of the nutrients they get absorbed. But the problem starts when you are just throwing up and you are not eating anything. So first trimester is first 12 weeks of pregnancy. In that 70 to 80% of the women, they experience some kind of nausea in pregnancy. It begins around 5 to 6 weeks of pregnancy, peaks at around 8 to 9 weeks of pregnancy, and slowly comes down by 13 to 14 weeks of pregnancy. Most of the women start feeling okay by 14 to 15 weeks of pregnancy. However, symptoms may continue till the third trimester in 20%. So what are the causes of this nausea and vomiting of pregnancy? First, most important cause is the high levels of pregnancy hormone HCG. Many times we tell the women who had bad obstetrical history or the miscarriages that feeling nausea is a good sign. That means your hormones are circulating in a good way. But then few women may not feel any nausea, so they do not have to worry. Even their pregnancy may be going absolutely fine. Also, there is reduced gastric emptying time because of pregnancy hormones, especially progesterone, relaxin, and all. So, stomach gets filled very fast. If we take a normal case, you must have seen sometime when you do overeating or there is a party, why do we feel so much nauseous and vomitous? Why? Because of the over distension of the stomach, the sensations go to our mind and brain, and few of the nerve fibers are stimulated, which lead to the vomiting sensation. Now, in pregnancy, the stomach emptying time is reduced. As a result, the stomach is already full. So whenever you will eat, it will lead to over distension of the stomach, and then in some people who are very sensitive, it will lead to the excitation of the vomiting reflex. Also, the gastroesophageal sphincter, which is present, the sphincter between the stomach and your food pipe, it may also be very relaxed, and in pregnancy, it relaxes. As a result, there is a reflux of the content. So that's why if you feel nauseous, you're not able to control the vomiting sensation, and irrespective where you are, you have to suddenly puke. So many times women tell us that, ma'am, I'm not even able to go to the washroom, or I'm sitting with in a party or with a guest, and suddenly I'll feel like throwing. So this is very natural, and I tell them that always keep, if you're having too much of vomiting, then you should always keep some bags with you, sick bags with you, so that if you're traveling, motion sickness is there, or you are in the market and some particular smell makes you nauseous and vomitous and feeling like throwing up, you can use that sick bag and it will prevent you from getting embarrassed in the front of other people. Also, decreased vitamin B6 and B1 vitamin levels, hyper or hypothyroidism, these also could be the reason for your vomiting. These are the normal physiological reasons, but many times there could be psychological reasons as well, and there could be pathological reasons. So it is seen more common in the first pregnancy. In multiple pregnancies, it is more common. Multiple means like if you have twins or triplets, because your hormone levels are much higher. If in previous pregnancy you have hyperemesis, then you may experience more in second pregnancy. But at the same time, I have seen many pregnant women who had higher hyperemesis in the first pregnancy, but in the second pregnancy they do not get, or the vice versa. Presence of trophoblastic disease. There is one type of pregnancy like the molar pregnancy, in which इसको अंगूर के गुच्छे की pregnancy भी बोलते हैं. In that also there will be increased vomiting sensation. If you are traveling, the sensation may increase, and complications like hypothyroidism, gut disorders, liver disorders, and psychiatric illnesses. So what happens when you are feeling nauseous? There will be vomiting throughout day and night. There may be excessive salivation. There might be dizziness, sleep disturbance. Then you may feel depression, anxiety. It has been seen the women who have hyperemesis in the first pregnancy, in first 3 months, they are more prone for depression in the pregnancy, mood changes, decreased concentration. Also, it may affect your interpersonal relation and social relation, because if you are having too much of nausea and vomiting, you may feel like just lying down. And if you are newly married, the partner may not be able to understand what you are going through, and then it may create some stress in the home. What are the clinical signs of it? You may feel dehydrated, but the problem is that if you are dehydrated and you feel like taking water, you may not be able to drink it. There may be weight loss. Now, in first 3 months, many women do not gain weight, which is absolutely fine. But some do lose weight, which not necessarily is pathological, but then we do not like you to lose weight. But if you have too much of hyperemesis or too much of nausea, vomiting, you may lose weight. Now, ultrasounds are very important in pregnancy. Those who are visiting us, they know that we do first scan around 6 weeks to see pregnancies in the uterus, then we do at 9 weeks to see heartbeat is going on well, and then at 12 weeks. So, if on the ultrasound the baby is growing well, then even if you have lost some bit of weight, you do not have to worry. But the problem is when you have sunken eyes, dry mouth, fever may also develop and blood pressure may also start falling down. So HEG means hyperemesis gravidarum. So if there is a persistent vomiting, weight loss is more than 5%, there is dehydration and electrolyte imbalance, and you're not even able to keep the water in your tummy, then we call it hyperemesis gravidarum. Now you have to understand the management is very simple. Most of the women go through it. The problem is that women they stop eating food. So it is very important that if you start feeling nauseous and or you start feeling suddenly that you're not feeling good or your blood pressure is decreasing, if at the same time you eat something, then your nausea feeling will go. Contrary to the fact that most of the people think that if they are feeling nauseous, they should not eat. But if you eat in pregnancy, nausea is also sign of falling blood sugar levels. So if you eat something solid, it will be better and probably you will not experience vomiting. You have to eat small amounts every 2 hours. You cannot have a big meal. As I just told you, that gastric emptying time is decreased. So if the stomach will get over distended, then again you will feel like having vomiting. At the same time, if you are, though you are eating well and you are resting well and still vomitings are happening, then investigations have to be done to make sure that you're not suffering from some other problems like thyroid test, which anyway in pregnancy should happen, liver function test, your serum electrolytes, and one very important test is your urinary ketones. If the urinary ketones are very high, then also you will not be able to keep anything in your tummy. So if a woman comes to us with constant vomiting and she is not even able to have water, we do the urine ketone test. If urine ketones are positive, that means that you have already gone into a advanced stage of dehydration. At that point, it is very important that you should be admitted in the hospital, IV fluids to be given, and you should not take anything orally till your urinary ketones they become negative. Otherwise, you will keep on vomiting. So it may take 1 day, 2 days, 3 days, whatever. But then, if the urine ketones are positive and you keep on eating, you will not reach anywhere. Secondly, important point is many women they take MSET or ondansetron in pregnancy. This is not approved by FDA to be taken during pregnancy. So the drugs which are approved are Perinom and Stemetil. So these are two drugs which you can take safely in pregnancy but not MSET. Also, if you're vomiting too much, then thiamine should be taken, which is vitamin B1, and it is very important because it prevents you from developing the complications of hyperemesis like encephalopathy. Encephalopathy means your brain get affected if there is too much of vomiting and if it's not properly managed. So all our women who come to us and they are having excessive nausea, we put them on thiamine tablets. It's one simple tablet, 60 milligram per day. MSET not to be taken. Perinom can be taken twice a day after consulting your doctor. And eating pattern has to be good. You have to take solid foods. If you are nauseous and there's too much of nausea, please avoid taking lime juice, empty stomach. Avoid taking juices, apple, amla, and nibu pani empty stomach because it will increase your vomiting sensation. Take something solid like you can take bread, roti, upma, poha, something which can absorb the acid. And what I always tell the women is that in the morning when you get up, even before you brush your teeth, you can just rinse your mouth and you can eat something. After you have eaten something, then brush your teeth so that the pharyngeal oropharyngeal reflex is not excited and you're not puking. Also, try to eat more of solid things rather than acidic things. If you want to take fruits, take it with something solid. If you want to take apple, take it with your meal or with your bread, meal, or upma, poha, something. Even some amount of water, if you're not able to take too much of water, what you can do is you can add true or you can add some flavoring to your water. Also, you can make mango shake or something and you can just freeze it in the ice tray so that you can get ice cubes and you can keep on sucking it whole day and that also helps. Ginger also helps. So main thing is, first of all, what I feel that if anybody is getting too much of nausea and vomiting and they reach the stage of hyperemesis, mostly it can be managed by good diet advice, eating small meals every 2 hours, and managing other medical problems, and giving help to the women at an early stage prevents them from going into hyperemesis stage. Now I invite my consultant, Dr. Cherry, to carry on with the further management. Thank you so much and see you on the next Tuesday. Dr. Cherry, please come.
Thank you, Dr. Preeti. Now we continue with the further discussion of the topic, that is the difference between the emesis gravidarum and the hyperemesis gravidarum. So basically, major of the women, they undergo the emesis gravidarum, which is more common, while the hyperemesis gravidarum is rare. Emesis gravidarum is more confined to the meals, while the hyperemesis gravidarum is repeated throughout the day, irrespective whether it is with the meal or without meal. Emesis gravidarum doesn't affect the woman's general condition, but definitely the severe form of it, hyperemesis gravidarum, it definitely affects the general condition of the women with the weight loss of more than 5%, dehydration, or the electrolyte imbalance. Emesis gravidarum, it normally suppresses about 12 weeks, while the hyperemesis gravidarum, it progresses. The course is more fatal unless effective treatment is given to it. Now, in emesis gravidarum, normally it rarely needs hospitalization, while hyperemesis gravidarum always needs the hospitalization. Coming to the next slide, please. Now, what are the differential diagnosis for this thing? So after the emesis gravidarum, the other causes which can cause nausea and vomiting during pregnancy, we have to rule out the other causes, that is the gastrointestinal disorders or the metabolic disorders like diabetic ketoacidosis, neurological disorders, and the pregnancy-related conditions of the acute fatty liver of pregnancy. Now, what is the effect of severe vomiting? In the effect of severe vomiting, the morning sickness could be due to the excessive vomiting, which can lead to because of maybe starvation and dehydration. Now, all these factors ultimately lead to the either in rare causes the vernix encephalopathy, or in the urine the signs could be there could be decrease in the urine output, or there will be concentrated urine which is more yellow in color, and it could be when we do the urine ketones, they come out to be positive as told by Dr. Preeti, with proteinuria and the bile salts. Now, what are the pathological changes regarding the hyperemesis gravidarum? So, these basically occur because of the prolonged starvation. In liver, there may be small fatty infiltrations with the kidney showing the fatty degeneration. Your heart could show some small subpericardial hemorrhages, while the brain, like it causes the petechial hemorrhages, leading to the vernix encephalopathy. The person might feel confused or may later on lead to coma also. With the eye, there could be a retinal hemorrhage with the nerves getting degenerated, and in the blood, there may be a decrease in the volume of the blood, which in the other form can show the hemoconcentration. That is, your hemoglobin level might be more in a higher range than the normal. So there is no reason being happy that my HB is 14 or 15, because you might be having decreased volume in your blood levels. And in the urine, again, there is decrease in the urine output, increase in the ketones in the urine. Now, what are different investigations we undergo? First is the urine test for the ketones with the LFTs, RFTs, and the thyroid levels. And the other one is the urine culture with the hematocrit, and the liver test ruling out the hepatitis screening. Now, in the rare cases, we might have to undergo the obstetric ultrasound to rule out the multiple gestation, or the upper abdominal ultrasound to evaluate your pancreas and the liver. And in the rarest of rare, the abdominal CT may also be required if patient needs to be. Now, what are the prophylaxis to it? Now, although there are no known ways to completely prevent this hyperemesis gravidarum, but following measures can definitely help them from becoming it the severe one. Like earlier said, you should have the eating small and frequent meals will really benefit you with the eating bland foods. Waiting until the nausea has improved before taking the iron supplements, and definitely taking vitamin B6 or the ginger tea can really help you in easing out your nausea and vomiting. Now, emotional support is also important. Now, while undergoing this nausea and dealing with the nausea and vomiting problem, the pregnant women may become depressed. So, family member support is must, and definitely a consultation is required if indicated. Now, the other thing which can help to ease out your nausea and vomiting is the peppermint essential oil. Aroma of the peppermint can help to ease out your nausea. So, fill a large bowl with the hot water. Place 2 drops of peppermint essential oil in the bowl and place it near the bed. So, aroma will really help you to ease out the nausea and vomiting. While educating patient is also important, telling them about the signs and symptoms of pregnancy may be beneficial, and if they feel getting that nausea and vomiting, how to deal with it will definitely help them to ease out that those doubts regarding the pregnancy, and poor communication between the doctor and spouse definitely cause increased stress to the patient. Now, what are the foods to fight with the morning sickness? So, watermelon, it really helps you to stay hydrated, and the sugar curbs the nausea. While the water in any form, it could be the ice cubes or ruafza or any of the drinks, you can take it to ease out the to prevent decrease in the volume in the body. Bland crackers get a little something into your system, while Greek yogurt is a good protein to fill your stomach. Potatoes are also easy to eat and fight nausea. Now, what are the managements to it? Definitely, the dietary and lifestyle changes are important. You have to separate the solids and the liquids. Eating small, frequent meals is definitely a good idea, and avoid the fatty and the oily potato chips with eliminating the pills with iron. You don't have to take it with empty stomach, always take it with the food. High protein snacks are definitely helpful. Now, some medicines may also help you to give some relief. Like medicines like pyridoxine, they definitely help and they are safe in pregnancy. They can be taken once or twice a day. Now, this is a chart which shows us, as told by Dr. Preeti, that tablet MCT should not be taken during pregnancy. Instead, Perinom can be taken, or Thiamine can really help you out in this method. And if the complication, if suppose the severe cases in hypermestoderm requires hospitalization, where a pregnant woman receives the intravenous fluid, glucose, electrolyte, and occasionally vitamins and the other nutritional supplements. So, what could be the outcome if we don't consult a doctor and we don't follow the measures? Then there could be esophageal rupture of or the perforation, or Wernicke's encephalopathy or blindness. There could be hepatic disease, seizures, coma, or even the death. Now, you have to know that hyperemesis gravidarum is self-limited in most cases, and it improves by the end of first trimester. However, the symptoms may persist through 20-22 weeks of gestation, and in 5% they may continue till delivery also. Now, as I was talking about the outcomes, so this is what is known as the esophageal tear, the Mallory-Weiss esophageal tear, as shown in the picture. So, where the food pipe and your stomach starts, you can see in the picture there is a Mallory-Weiss tear out there that occurs because of the excessive vomiting. The Wernicke's encephalopathy. So, what do you mean by that? That is a syndrome because of thiamine deficiency that may cause disorientation, confusion, and the coma. And definitely, the patient needs to be hospitalized and treated accordingly. Now, nausea and vomiting, it really impacts with the physical and the emotional stress over the patient. It results in the feeling of anxiety and worry about the effect of symptoms on the fetus. It has a negative impact in the family relationships, and also it decreases the women's working abilities. But don't you worry, we are there to help you out. So with the follow-up, if the patient is the inpatient care, In the inpatient care with the patient of nausea and vomiting, that may be necessary that they should be given the IV tubes and electrolyte imbalance should be maintained well, and the nutritional compromise should not be there. For the outpatient care, patients should be monitored regularly with paying attention to the symptoms and to the state of mind of the patient and the family. Monitor weight and the urinary ketones at the each visit. So, what are the prognosis? Hyperemesis gravidarum is a self-limited condition. In most cases, it improves by the end of first trimester. However, the symptoms may persist to 20 to 22 weeks and in some cases till delivery. Thank you so much for the patience listening and best wishes for ahead in the future.